1 month after nurses across Massachusetts told 25 investigators decontaminated masks were making them sick, the Food and Drug Administration is changing the rules, saying certain masks used by healthcare workers shouldn't be reused.
The Massachusetts Nurses Association first warned nurses about decontaminated masks 2 months ago. On Sunday, the FDA issued a policy change saying testing done by the Centers for Disease Control found some masks are not safe after they've been sterilized.
And what we said right from the beginning was this had an emergency approval as an experiment.
Donna Kelly-Williams, the president of the Massachusetts Nurses Association, says she wasn't surprised to see the Food and Drug Administration tighten the rules for decontaminating face masks.
All of my 45 years as a registered nurse, we were trained that those N95 masks, those masks that you put on your face, are disposable.
This past weekend, the FDA announced testing has shown authorized respirators manufactured in China, quote, may vary in their design and performance and should not be decontaminated for reuse by healthcare personnel.
That has been the MNA's view all along.
Judith Perret is the MNA's director of nursing education. She says the nurses union first sounded the alarm about the FDA's same concerns in April, less than 2 weeks after the agency granted Battelle's system for decontaminating masks an emergency authorization.
There is no reward in I told you so when it comes to health and safety of not only our nurses, but the public at large. But what we were asking for was evidence-based information to support that this practice was safe and effective. And clearly the reversal of the FDA calls into question both those areas.
Soon after getting FDA approval, Battelle teamed up with Partners Healthcare to bring a decontamination unit to Somerville with the promise of being able to sterilize 80,000 masks a day using a mixture of hydrogen peroxide and alcohol. On Monday, 25 Investigates asked Battelle about the FDA's updated rules. A spokesperson told us the FDA guidance was for cellulose-based N95s and N95s with respirator valves, etc. Our system does the standard non-cellulose N95s, so this does not impact our operations.
Our concerns are not wavered by their statement. I stand firm that the best and highest quality of PPE, personal protective equipment, includes a new disposable N95 mask.
Kelly-Williams is reminding nurses they have the right to refuse to wear decontaminated masks.
Hope going forward that when the nurses are the canaries in the coal mine and they're telling you something isn't going right, please listen to the nurses. If we're sounding the alarm, listen.
In April, the federal government awarded Battelle a $400 million contract to sterilize N95 masks for reuse. In light of the FDA's new rules, the Massachusetts Nurses Association is calling for the money to be redirected now to support the production of new N95 masks in the United States.